Hello everyone, I am Dr. Somalika Pal and I am practicing as a senior consultant neonatologist and pediatrician at Cloudnine Hospital, Kailash Colony, New Delhi. Very commonly ignored area of discussing with your pediatrician when you see your pediatrician with your baby is the oral and dental hygiene. So especially when you are starting your child on solids beyond the age of 6 months onwards, you should make it a point to ensure that you discuss the oral care of your child with your doctor. The reason being that even though a child would probably be teething starting from the age of around 6 months, some children may teeth as late as 1 year. But as soon as we start solids, it's very important to ensure that the oral flora that colonizes the mouth stays healthy. So for that, whenever we are offering solids to our child, one very good idea is to give them or offer them sips of water immediately after solid. That helps flush out any kind of residual matter, solid matter that is there in the mouth. Second is when the child is eating, it's a good practice to actually practice responsive feeding, meaning that as a parent, we are sitting one-on-one with our child and making sure that our child is actually engaged with the act of eating. The act of eating should not last for hours and hours together, where we are actually following our child around and making sure that we are following our baby and offering one spoon here, one spoon there. So let the child decide when he or she wants to eat, and if he or she is done, the child will let you know, and please respect his or her wishes. So usually one episode of food interaction or a meal should not be lasting more than 25 minutes at max. Especially when the child has teeth, what happens is whenever we are taking in any kind of solids, the pH, local pH actually comes down, which can be a predisposition to atypical colonizations and dental caries later on. Once the teeth emerges, it is extremely important to start brushing your baby's teeth. So an age appropriate toothbrush with a very, very small head can be used, and this toothbrush should have ultra soft or super soft bristles. So there are many commercially available in the market, and parents should be brushing their teeth at this age. Before the teeth has erupted, so if your child has started solids but the teeth are yet to erupt, a lot of finger brushes are available in the market, or you can use a clean gauze piece around your finger for massaging and cleaning the gums, the palate and the tongue of your baby immediately after, or finger brushing techniques can be used. Once the child has developing teeth, till the time a child effectively learns to spit out the toothpaste, it's a good idea to use a fluoride-free toothpaste for your child, because the adult toothpaste have very high fluoride content, and ingesting so much of fluoride over a period of time can actually be detrimental to and toxic to the baby. So initial days we start off with fluoride-free toothpaste. If you start noticing any kind of chalky white patches on your child's primary tooth once the tooth has evolved, those are incipient lesions, and you should absolutely see a pediatric dentist with them so that you can be guided further, or your pediatrician or your pediatric dentist, so that you can be guided further about the preventive oral health of your child. So once the child is reached an age where they can now start spitting toothpaste, so beyond usually by 2 years of age or 2 to 3 years of age, then we can move to a relatively lower fluoride containing toothpastes available in the market, and the quantity of the toothpaste should be very, very small. So usually rice grain amount or just like a stain on the toothpaste is enough for brushing at this age, and frequent sips of water after meals, and not increasing the meal times too much. Again, the tongue cleaning, so there are tongue cleaners available, especially if your child has developed incipient lesions. It is an absolute must that the oral hygiene is maintained. So specialized tongue cleaners for this age group is available. Brushing of teeth and caring for the oral health should be, although the child should be taught independence in these areas as well, but predominantly brushing should be undertaken by parents to achieve any kind of effective cleaning of the tooth, especially till the age of 2 to 3 years, and sometimes even beyond that. So it depends on the developmental readiness of the child, but mostly to be able to brush the teeth between interdental spaces effectively, the molars posteriorly, and the inner aspect of the tooth effectively. Parents should have the control over brushing for a significantly long age, sometimes even up till the age of 3 to 6 years. Thank you.